Thank you, Akira. Hi everyone, I'm Yu Shifei and I'm going to talk about the usage of technology in the healthcare sector during the COVID-19 pandemic. As we can see, the COVID-19 pandemic has had a great impact on the healthcare system. This has led to a huge acceleration in the adoption of digital technology in an effort to curb the rapid spread of the COVID-19. So, the question is, how technology has functioned in the healthcare sector during this pandemic? Firstly, big data and artificial intelligence (AI) help to facilitate the tracking of people and the spread of infection. According to the World Health Organization (WHO), the incubation period of COVID-19 ranges from 1 to 14 days. Thus, people who had shared public transportation and close contacts of confirmed cases in the past 14 days might be infected and become potential source of infection. To this end, an application called MySejahtera was launched by the government of Malaysia to assist in managing the COVID-19 outbreaks. The check-in and check-out feature improved the contact tracing as we were required to scan QR code before entering a premise. When someone was tested positive with COVID-19, data captured using this application enabled the government to trace contacts and send notifications to people who had been in close contact with that patient. According to Tan Sri Dr. Noor Hisham, the Director General of Health Malaysia, so far there were 4,565 persons under surveillance and 1,868 persons under investigation had been detected through this application. Besides, the hotspot tracker function in the MySejahtera application helped to detect COVID-19 cases within a 1 kilometer radius of a search location in the past 14 days so that we could plan our commute and prevent non-essential travel into risky areas. Secondly, technology allowed rapid diagnosis and risk prediction of COVID-19. For example, in China, a cloud-based AI-assisted city service that can process city images in seconds was used to detect COVID-19 pneumonia cases. Other than that, some countries used virtual platforms such as video conferencing and digital monitoring to deliver remote healthcare service to patients. By using this method, the risk of healthcare workers getting infected in the healthcare institutions will be reduced. In our country, the MySejahtera application allowed the COVID-19 risk to be assessed by answering the questions about our symptoms and whereabouts in the last 14 days. Apart from that, the virtual health advisory feature in this application provided free COVID-19 virtual advisory for the public. We could also get information about COVID-19 on this platform. Lastly, technology was used to screen infection. As we all know, one of the common symptoms of COVID-19 is fever. Thus, many countries set up digital thermometers at the entries of several places to measure people's temperature. In some countries, high-performance infrared thermal cameras were used to capture people's thermal images in real time. This technology reduced the direct contact between the management personnel and the tested personnel and thus reduced the possibility of the spread of the pandemic as well as improve the detection speed. In short, it is undeniable that technology has facilitated pandemic strategy and response in ways that are difficult to achieve manually. So, let's make good use of the innovative technology to help control the pandemic. That's all from me. Now, I'll pass the time to the next presenter, Shamina Bila.